My first part-time job at Sioux Valley Hospital then was exactly that, washing the surgery walls in the afternoon. Back then we did not have air conditioning throughout the hospital, and so the surgeons would do all their surgery in the morning when it was cooler, and they would schedule very little surgery in the afternoon. And that's when we would wash the walls and then rub them down with ammonia after we got them washed. And I did that for a while, but being a farm boy, why I was not too excited about washing walls. And so I was kind of from day one, I tried to do my job the best I could, but I also was looking around to see if there wasn't some other place that I could work. I was very impressed with the people. I did not have a position of any consequence when you think about, maintenance, laundry, these kinds of things. But the thing that impressed me was that everybody was so friendly, and it didn't really make any difference who or what you were doing. You were accepted as one of the employees, and I sure did appreciate that. Well, there's no question that what we have now is the culmination of a lot of thinking and planning over the years, and the current folks are doing a really fine job of developing the system approach to taking care of people.
Your management style has been, very participatory and yet, firm but fair. But any words of wisdom to younger administrators, to myself, to anybody, what was your secret of success to have people from 5 different generations that talk about you? They didn't even work for you, and they still, I remember Lyle. There's no way you possibly could have known Lyle Schroeder. You weren't even born yet. So what do you tell people?
You're very kind, Paul. You're very kind.
Well, you're the only one that says that, Lyle.
Yeah.
Nobody else says that,
Yeah.
so that's okay.
Well, I think one of the things that I was taught from one of the former executives at John Morrell plant. And this executive told me, he said, Lyle, he said, in the Morrell plant, or whether it's a hospital or wherever it is, that people want to see the big boy, the manager. They want to see the president of the company. And he said, too often, he said, the presidents get into their carpeted rooms and they stay there and nobody sees them. So I was always an early riser, and one of the things that I always tried to do is I'd take the elevator up to the top floor, and then I'd walk every unit all the way down back to my office. So I was at least in the units every day, and I always had an objective that each day that I should visit a patient, because if I didn't, then I may forget why we were here and who we were here for.
Lyle, do you remember your last budget? What was your last budget again? Was it $250 million, $240 million?
I think it was something over the $200 million, Paul.
Yeah.
And I think my first year end when I was here was $1.7 million.
Wow, $1.7 million wow.
Yeah.
Would it surprise you to know that today we're about $1.3 billion?
No.
Isn't that something?
That's something.
With
I agree.
7,000 employees. Yeah. I think that as you look at Sanford Health and what we represent and what we can do, we're one of the very few that can do or have the pieces to do everything, which is amazing. So I think we're really positioned well.